Basal cell carcinoma, also called as the rodent ulcer or Jacob's ulcer, is locally aggressive, non-metastasizing malignant neoplasm of the skin characterized by a medullary pattern of basaloid cells. It usually originates from the basal layer of the epidermis or the hair cells. Etiology is usually due to chronic, occupational, or recreational exposure to direct sunlight, usually common amongst the fourth decade males, and also people living in high temperature and low humidity areas. Sites are common over the hair-bearing areas. In the orofacial region, it is the upper lip, the nasolabial fold, the periorbital region, the cheeks, and the forehead and ears. Coming to the clinical features, it is a slow-growing, firm, slightly elevated, small nodule or a papule with prominent blood vessels. Few of them are flat. They can be red or brown in color. They gradually enlarge and develop as a central clustered ulcer with elevated, rolled, smooth borders. They usually heal centrally and they spread centrifugally. Intermittent bleeding from these ulcers can be seen. Coming to the histological features, the neoplastic proliferation of the basaloid epithelial cells can be seen, which form multiple solid islands or strands. The cells of the basaloid layer of the dermis seems to be invading the underlying dermis. Coming to the periphery of these islands are usually lined by columnar cells, which resemble the basal layer of cells, with a hypochromatic nuclei, which are uniform in shape and size with a palisading arrangement. The center is usually polyhedral, oval, round, or spindle in shape. The intercellular bridges are usually absent, and a apoptosis of these cells can be seen. Differential diagnosis is a myeloblastoma, salivary gland neoplasm, and squamous cell carcinoma. Here we can see that in the periphery we have columnar cells with a palisading arrangement, and the central cells usually are oval, polyhedral, round, or spindle in shape. Coming to the treatment part of this is usually surgical excision or electrocautery. And in the small picture, we can see that the basaloid cell carcinoma of the epidermis have nests of basaloid cells with scanty cytoplasm and elongated hypochromatic nuclei. There's peripheral palisading and myxoid stroma, and also a peritumoral cleft.